Hi, I'm Dr. Kavipriya Soma. I'm a GP with special interest in women's health. So we're continuing with the topic of infertility. So we have already discussed the what is infertility, the causes in our first video. So if you'd like to take a look, please have a look at that. In this video, we will discuss about the investigations that is needed for the diagnosis of infertility and what are the treatment options. We're going to be very simple and basic. I'm not going to elaborate on all the treatment options because they are generally tailor-made for every individual person. So if you have more questions, please ask your doctor or seek help from appropriate health professional. I'm only here to just give you general advice. But if you'd like more specific advice, again, please visit the website to make an appointment or for the consultation. So what are the tests that are required in terms of infertility investigations for the female? So I'm going to bring the model so I can explain it to you again. So as seen here, we're dealing with ovaries, tubes, and uterus. So what are the tests available to check ovarian function? So what does ovarian function mean? So that means the ovary is actually releasing the egg or not. So something as simple as testing progesterone hormone on the 21st day of your cycle, if your cycle is a regular 28-day cycle. That can tell us if the egg is being released or not. Second thing would be also to check for hormones in the first day 1 to day 5 of the menstrual cycle, which will give us the baseline hormone levels. Now there will also be other hormones like a thyroid function test and prolactin that needs to be checked if you're being investigated for infertility, because they are some things that can inhibit ovulation as mentioned in the previous video. Now the second investigation or second organ that needs to be investigated is the fallopian tube. Now how do we investigate fallopian tube? There's a couple of options that can be done. One is under X-ray guidance. There will be some dye that gets injected in through the cervix to the uterus that can go out through the fallopian tubes into the tummy. So this is a non-toxic dye and that can be visualized on X-ray. It is a simple procedure, but it may cause some cramping during the procedure. So this is one way of detecting if the tubes are working or not. The next way that the tubal function can be detected is under the ultrasound, using the same principles, but under ultrasound guidance, this can be done. The advantage is that with ultrasound, there is no radiation exposure, and also we can assess the ovaries simultaneously when the ultrasound is being performed. So under the ultrasound, there are various types. Again, what can be injected? It can be simple saline, it can be saline bubbles, or it can be colloidal solutions. Please check with your healthcare provider for what options you have in your local areas. Now, this also can be done through surgical. So if you're having a surgery, say for example, fixing endometriosis or any other type of surgery that is being done for the pelvic organs, then if you are someone who is struggling with infertility, there can be tubal patency testing that can be done during laparoscopy. So where a dye is injected and then the spill can be visualized directly under the camera. So now coming to the treatment options available for infertility. First things first, I know for who have listened to my videos before, I always emphasize on nutrition and exercise. I'm sorry to say that still has to be done even if you're going through this problem. It is really important that you eat healthy and exercise, because infertility is partly physical, but also it imposes a huge psychological burden on the person or the couple per se who's trying to fall pregnant. So to manage both, it is important that you look after your nutrition and exercise. Second thing, what you also need to do is to avoid alcohol and smoking, because both of them can also inhibit ovulation. The third thing that you can do that is still within your control is reduce stress. The moment you stress, the first thing that goes out of your body is ovulation. So it's really important that you don't stress. As much as I can say it, unfortunately, I understand that you will stress. How to mitigate stress is up to you. So whether you go and do walking or meditation or swimming or yoga, you choose. But that must be something that you enjoy and which you can put in consistently. Most people will come and tell me, oh, I exercised, I lifted 20 kilos every day for the last 1 month. Nothing has changed. Nothing will change in 1 month. Unfortunately, consistency is the key, and patience. There is every potential chance that you can have a child. Don't be disheartened. It may be that you may need some help, but it's always possible. Nothing is impossible. But it is also important that you look after yourself. You prepare yourself for what's to come. Don't give me the excuse of, I don't have time. If you don't have time to do this, then how are you going to find time when you have a child? So prioritize what is important to you and start now. So in terms of the management options available for female factor infertility, it can be broadly classified as medical management, then surgical management, and reproductive assistance. The underlying basis for all of them, as emphasized before, would be eating healthy and exercising. We're not only looking at physical, but psychological as well. So those two never goes out of fashion. So what are your options in medical? So under medical management, it can be oral medications, as in taking by the mouth, or it can be injectables. So you would definitely need to be under a reproductive fertility specialist who can prescribe these medications for you after determining at what levels you would respond, depending on the investigations that you have had. But just to give you an overview of what is possible, I will briefly mention these medications. So if you're a person who has issues with polycystic ovarian syndrome, sometimes metformin can be prescribed to help regulate the PCOS condition. So that will help with your weight reduction, as well as change the internal environment so you respond better. Now, some of the other medications that can be used for ovulation induction, as we call it, could be oral medications like clomiphene or letrozole. Again, the emphasis would be these are generally prescribed by fertility specialists. So please seek appropriate guidance to receive these medications if it is suitable for you. The injectable medications would be GnRH analogs. Again, they are specialist only treatment options. So your specialist will advise you if this is something that is appropriate for you. So please seek appropriate advice through your healthcare professional. These will be the options that is available to you under the medical management. Now, surgical management. Surgical management is offered to a person who has, say, for example, like endometriosis or adhesions because of previous pelvic infections, where it can be surgically released, or the endometriotic tissue, if it is coming in the way of you falling pregnant, can be removed during the surgery. So that's generally where the surgical options will come in. What does reproductive assistance mean? Reproductive assistance means that the two important broad class categories would be IUI and IVF. So intrauterine insemination and in vitro fertilization. Again, there are many sub-classifications of this, and if this is something that you require, your healthcare professional or the fertility specialist can explain this further for you. So far, we have discussed the physical management options, but like mentioned before, please understand that psychology plays an important role in managing your infertility issues as well, because this is quite an arduous and stressful journey. So it's important that you look after your psychological health. Again, if you need help in terms of managing your psychological health, basic things like, again and again, I'm going to say the same thing: diet, exercise, yoga, meditation, or seeking professional psychological help will help you prepare yourself to get you through this journey. So if you would also like more information on any of the discussion points that we've had today in this video, please let us know in the comments so we can offer you more information on those topics that you'd like. So if you would like to make an appointment or discuss further regarding infertility, please visit our website www.athenawomensclinic.com.au, and you can click on for the appointment for the doctor, or please visit your own healthcare professional who you're comfortable with. Thank you.